I'd give him 2, which is going to be enough to hold him still to get my catheter in. And then give him the 8, give him the other 6 as my pre-induction. That's all. It was my 2 was mostly to get the catheter in.
Yeah. Okay.
And then it's, you know what I mean?
Yeah. I mean, I guess.
Because I think 6 might be enough for him, but 8's going to probably be plenty.
Yeah.
So that was
Like,
right without.
to get that big dose in, like we are rolling, like catheter fast, and ready.
Okay. Well, I mean, yeah, and he's not, like I said, he's not a stupid idiot. He's just young and worried. So yeah, I should butt out.
He's never been off the face.
I think so too. Yeah. So I was just starting to say Dr.
Good boy.
Good
boy.
You gotta get the
catheter this side, Matt, so we get the neck up over on this side.
I was very pleased. I was my first rotation ever.
On the other side or same side of the catheter?
That's up to these guys. I'll leave it up to the
It ain't gonna be that bad.
No, he wasn't acting like a monster at all.
But then, you know,
It's his first time off the property.
yes.
Typical. Like every one of them.
I love it. I simply they had a so kind of dose range to have in head if you're like give it a little bit for a day.
But he was letting me touch his vein and stuff over there. He just.
They get cold feet. They're just like, I pulled out the piece of that they want. They're soaking in the bucket right now.
And I don't know if you heard what I was saying to them about the idea of a little bit more sharp dissection, so you're having to do less blunt dissection, if you would like, whatever you're comfortable with.
Yeah.
But to me, that's kind of it's nice to practice that a little bit.
Definitely.
It's less physical.
Yeah, you don't have to fight with it.
You don't have to fight with it. And I mean, and he's, even though he's only 4 supposedly, and I don't know, I haven't looked in his mouth. He's got big jowl. I mean, he's kind of mature looking.
Yeah.
So it might be more mature tissue than I'm anticipating on a young horse,
And they're
right?
pretty sucked up there too.
Yeah.
So
Yeah. So I think, to me, it's kind of a nice. And it's good surgical practice anyway.
So I'm gonna do the doils. Pull up 30% of the scrotal.
Yep.
Sheath and do doils. Slice that
Doyen?
off with doyens.
That's okay.
Slice
I never
that
remember
off.
the names of things, but I remember that now.
What I have a problem with when I'm slicing is it's like jelly, and I'm trying to like keep going, but it then like squishes back together.
Yeah, and it's hard with a free scalpel blade and a knot and a handle. But to me, it's like it's not worth the time futzing with putting it on the handle.
Yeah.
Because I'm going to use it for so little.
Yeah.
But if you want to put it on a handle, I think they've got handles for us too. But if you're doing it with the free blade, and he's big, I mean, it's just harder but you just have to get that feel of, of how that goes.
Like the more cranial part, I'm gonna put that one under, and then put the longer edge here, so I can cut through that, and then just slide the blade on the last portion of it. I feel that might
make it a little easier for you. Sure.
And then that way I'm.
Listen in here. Go ahead. What was your question?
Oh, I was just going over the process.
Yep.
Again. So once I get the scrotal ablation done, I'm gonna pull up one of my testicles, slowly cut down, paint down towards the.
Okay. So what is your non-scalpel blade hand doing at that point?
Pulling up on testicle, but not too much force.
Right. So
holding it.
What
so
you want to
it's
do
nice and
is
stretched.
yeah, exactly. You're going to kind of crimp it just like you were doing to get your block in. You're squeezing that to kind of like you're trying to pop that testicle out through that fascia, so that you get really nice taut fascia.
Yeah.
That makes it a whole lot easier.
And then strip it down with my hand going down.
Yeah. And you want to use gauze?
Gauze.
The discussion was sort of like they were starting with 6 xylazine on a horse this big, and if he were a broke, quiet, at-home horse, I think 6 would have been the right dose.
Yeah.
He's not.
Mm-hmm.
I think you gotta add, because that's my,
Yeah.
that's my comfort level. You
Mhm,
know what I
yeah.
mean? Like, I'd rather add the 2 now
Mhm.
than the 2 10 minutes in,
Yeah.
because I may not need to add any more after that.
Mhm.
And yeah, maybe it's a little heavy-handed, but okay.
Mhm.
Lovely. Nicely done.
You've injected already? Yeah. Good, okay.
Cool. All right, so
What'd you give him?
2 mLs of xylitol.
2 ml?
Yeah.
Just to slow him down.
just enough to get the catheter in and make life easier. All right, so what you want to do is get your catheter stuff going right away.
Are you going to put the catheter in?
Yeah, which side do you want to do the catheter through? I was going to do it on the other side. Okay.
Well, Matt will swap.
What do they do with him? Do we know?
They just got him over just as like trail riding and stuff.
But he's not broke to do that yet. Yeah, she said he's kind of halter broke, but that's about it.
So remember when you're scrubbing, I like what you're doing with the betadine. Like,
Do you want to switch the halter?
Out, but when I alcohol off,
Or you want to wait till his other drugs are in?
Okay. So I kind of start
Do you have one ready, or you want me to find you one?
like in the top.
Let's see if I can find a halter for this guy.
The box of halters is still in the trailer.
Okay.
The box is falling apart.
Let's find him a beautiful halter. That's awfully little for him. The bigger one.
It's a better timing. The timing's bad. They're unloading a couple of studs right now.
Yeah. Yeah, well, they need to get going on the net. Oh, they've got one in already. Okay. Yeah, they're not coming this way, as far as I know.
Four-ring circus.
Because I don't want to leave the catheter blocked.
There you go.
Thank you.
You're welcome. I think that'll fit him.
The goal with our xylazine was to
That
get
looked
it
like it was a pretty
easy
good size one.
enough. That obviously, it's not that much, but we'll. I know you're cutting right now.
Yeah, he didn't.
Yeah, sure. You don't mind. And so again, repetition is key. I like to find my spot, make sure the body of your catheter is always parallel to that. Go 45 degrees through the skin. Hi-ya, it hurts.
Nose to your way a little bit, Matt, if you can.
Huh? Have your finger
his
over the
nose
end of the
Matt's
hub, your
way.
pointer finger covering the end of the hub.
Covering the
Yep,
end of the-
yep. Because if you had flush in there, that's how you would keep it in there.
So then just
Yeah, I mean, don't come from far away, but it does take more force, and do watch your arm, because he's going to do that.
Yeah,
Let's give him some more xylazine.
I agree.
Do you have your little catheter guard still? You can kind of
It's in
tuck
my
that back
and
in.
yeah, and you could put. You already got your torb in your main xylazine.
Nope.
You want to put your torb in with your, or are you afraid to do that?
Do you want?
No, I'm asking
Teach
you.
us anesthesia.
Sorry. No, I was asking if you.
I want to do whatever Charlotte wants to do.
What do you want to do?
Charlotte doesn't know what she wants to do.
Yeah, you do.
Yeah,
I
you
would
do.
like to do, okay, executive decision. I would like to just give the pre-med without the catheter and then place the catheter
Okay.
if possible.
Okay.
Yep.
Yeah. Let's do it and see what happens. This is the time to experiment, right? Because you have a lot of help here. So try things and be like, well, this didn't work last time, or I think I want to change this, because you have a bunch of backup.
Right, but you only got 2 arms, and if you break it in that shoot, it's so not worth it.
Yeah.
Okay, so I'm pulling up your 6 mils of xylazine. Actually, we're gonna see.
that's with his 2 mLs of xylazine. That's why I just, instinct was that 6 mLs of xylazine wasn't going to be enough for him.
Yeah, we saw that back there. He was...
Yeah, that's it. You know, that's just. There's no reason to start that light. There's just no reason. So now they're giving him an additional 6 plus a half of torb, and I think that's good. I might have stuck my torb in with my first xylazine stick on this guy, just because.
Yeah.
You know. If I was going to give it anyway, I would have probably put it in with that first bit of xylazine. He fooled us a little because he was being pretty good about going in the chute, standing in the chute, letting us pet him. But then as soon as we started doing stuff, he's a little more ready. Like, why? Okay, now I got to fight him. His fight instinct kicked in a little, huh?
I was going to hit him with 3 xylazine, half torb, place my catheter, evaluate. If I think he's good enough, I was going to go straight in. Like 6-ish.
Yeah. So I would feel good about adding to that. Make it a 1-stroke deal. I think when you get in trouble is when you have to bump before you get the camera.
Yeah. Are you in? Yeah.
So
Now is a bigger dose.
it just like cracked a little louder than I wanted to. I think it's fine, but something in the
What happened?
no, the boards.
Oh.
I just almost fell off the back of the stocks.
No, don't
I
get
stood
bucked
on
off
the
the
edge
stocks.
and it was a bit louder of a crack in wood than I like to hear. Okay, nice job. Okay. First I'm gonna put exam gloves on, and then we're ready. I don't know what substance I have in my mouth, but it's very bitter. I don't know.
It was from talking to me.
Oh, poor Neil.
All of my blood samples are sent up down there. Okay, and then alcohol's here. Great. Just from talking. Never.
This is not small.
Yeah, so get your catheter in. It's gonna go a little easier now. I hope. Yeah. Yeah, that's the thing about stocks is they're wonderful help, but they add a level of danger to it, right?
This is good.
Yeah.
Much better. Okay, noted. Just
Here, you want me to hold that for you?
please.
Since you got extra hands.
Yeah, use us.
Thank you so much.
As retribution for that, we're gonna tell you all of our opinions at all moments of all time.
Right. That's what we mean by help.
This is helpful, right?
Does it help if I do this? Does it? Does it? Can you lift that up a little bit more? Thank you.
But then she wants me to put it down. Can you? Give 4 mils. No, 6. No, 12.
Okay, let's
All
get
right.
his, here, I'm gonna flip his mane over.
What do you want to do?
I want the mane on this side. No, I don't.
Yep, you got him this time.
Yeah,
And
so,
I know he looks nice and wobbly right now, but always
and that's
always remember he can
your
jump in any
double-edged
direction.
sword of getting all your drugs before your catheter is now you've got a droopy horse and a droopy vein.
Yeah.
So it's, you know, pros and cons.
Droopy horse over a bleeding.
Oh
Yeah.
yeah,
Finger
that
over the hub.
absolutely.
Finger over the hook.
Yeah, that's good practice for when you have a flush catheter.
If you
to
can
keep
lift
your
him
flush
up
in.
at all, Matt, that would be helpful.
Yeah, he's trying to.
Yeah,
And
that
then
could.
bring your lead ropes, you bring his nose over towards you.
Yeah, nice.
It points up the
I know we made him hammered for you to deal with. Okay, yep,
Poking.
yep. Good commitment. Now check. So keep your stylet into your hub. Yep, yep, good job. So stop moving. You're occluding, right?
Yes.
Yep, you got your finger. Yeah, is it still bleeding? Yes. So flatten towards him, hub towards him, advance about a half inch further. Should still go smooth. Yep. Stop, check. Before you advance it, occlude, and I want it to drip blood. Still bleeding? Occlude lower. Yeah, good.
I think you're pretty shallow. Look, from my, come over here and see it from this angle. You can see where her needle is better, I think.
I'm right here.
See if you can lift his head a little bit, Matt. Not really. You can't can you lift him up a little bit?
Sorry, I got it.
Or so now that just turns him. Yeah, there you go.
So you're in. Yeah, so come take over again. And now that you're confident you're in, I want you to bring your left hand up to the clear part. Hold on to that. Do not move your left hand. Advance with the right. Yep. And then is it all the way in?
Yeah.
Okay, I'm still occluding, so pull your stylet. Is it dripping? Remember, we don't want
Some flush.
He's got a lot of blood to let us out, so this is fine. This confirms we're still in a good spot.
Hold the cat.
And that cap in your mouth you could have whacked on to save yourself time to get your purine, but it was right there, so that's fine too. Okay?
A needle for that flush.
Yeah.
Hold the cat before it washes.
Flushes nicely, but oh, I don't trust it.
You're up against the tip of it somewhere.
Yeah. Okay. Oh. Here, let me grab it from you again.
All right.
His head.
Yeah, no, he's not badly too badly put together, huh?
How do you feel
Hi,
about this
bud.
hallucination right now?
Too bad. I mean, he looks like. Yeah, he's pretty ugly. I feel like if Greg.
What do you think about that?
He will.
Yeah. Yeah. What do you want to do about that? I could give him a little bit more. Yeah.
2 mils, is that what you were saying?
Yeah, and you could. Well, I'm just saying what I do with them when they're like this. You're like, is he sedate enough? I give them 2 xylazine and immediately give them the xylazine or the ketamine, and that way you've got them both in there. By the time the ketamine hits him, the xylazine starting to hit him, and in
Could-
my world at least, they don't have a wreck. Okay.
Yeah.
Yeah.
Okay.
I think that sounds reasonable because
Yeah.
because unless he's stimulated, he's not
Yeah.
being
But as
bad.
soon as you stimulate him,
Right. He's a little right.
Anesthesia record. He needs to be writing all this
Yep.
down.
Yep. So get that in. Get that. You want anybody to? I need to draw you up too.
yes, please.
While you're writing, I'll draw too, so you don't have to waste too much time. Because because now time is of the essence on your other dose, right? So that's what you want to be careful of, is that you're not letting your other doses go away too long. So here's your 2-xylazine and your ketamine and a flush. Okay, I'd say let's roll with it. Oh, careful. I'll give you that. I'll hand you the others as you go.
And then if she's inducing, can I go ahead and
Let's wait till those are in,
Okay.
just in case. It's there. He's just got it way up. We'll see if it drops well. Yeah, but see that reactivity still?
He says, no, thank you.
You got both of them in your hands, right?
She's got a holder assisting. So blast that in, and you don't have to flush, just blast this in.
Ketamine.
Ketamine going in, you got your rope ready. Push it in, push it, push it. Keep pushing up, just push it in. Yep.
Can I slide this over his back now?
Hang on, wait. Let her get it flushed.
Okay.
You got time.
You're good.
You've got a good 20 seconds.
Excellent. And I wouldn't have drawn back because with that flush, because you don't want to suck your ketamine into your flush,
Oh, okay.
Yeah.
right?
Yeah.
Yeah. So don't when you're flushing your ketamine, don't draw back.
You can aspirate into your drugs if you want to check the catheter.
Yeah, but not your yeah.
Okay. You can go ahead and take
Okay.
it.
So what I would like to do
Go in, go in.
is get that down. No, other way, dude. Perfect. So safely go to find your loop. Watch those swingy front legs. So, yep. Excellent. Yep.
Bring the whole tray.
Good. I'll help you bring your rope back. How you feeling? Good about that. Watch his swingy legs. Okay. Make yourself a loop. Sorry, I probably pulled a little too much through for you. Yeah. You got to make your loop first. Yep. And then put his foot through it. Yeah, that's okay. Here, just take this.
Okay.
Round his foot. I'm gonna come over so I don't get kicked.
Yeah.
And like that. And then I just make sure that
That's
is
over that
snug.
hitch.
Yep.
Okay.
Because that hitch will it'll make it harder for you. And I'll help you fold him.
Are we doing his feet also? Or
I don't know that we are. I don't know. I haven't seen the paperwork. Okay. I'll pull like hell. His penis is fine.
Okay.
I'll keep an eye on it for you. But yes, you're correct in worrying about it because you don't want to catch it. Yep. A little more pull. There you go. Okay, you can stop there for a second.
Okay.
Reach across to his hock. No. Keep yourself where you were. There you go. That's a say. Nope. Down to his hock. Yep. And get that leg starting to flex, and then work your hand down towards his foot from underneath, and then under the pastern. Yep. And then use your rope, rather than as your fulcrum,
Yeah.
so that you can do it like this
Okay.
and you won't have to use as much arm strength.
Okay.
So you're going to need to pull up on this rope another time. I'm trying to let you do it as much as you can. So Greg's there to help a little. He's a big boy, I know. So let me show you something.
Okay.
But so one hand on this and one hand on this,
Yeah.
pulling up here and down here, pulling up here and down here.
Okay.
So you're sort of cinching it in.
Like cranking it?
And then that's using your body weight,
Okay.
look like that, so you know it's nice and tight, okay? Good, just like that. I think you're good.
Okay.
And now loop it around his pastern. There you go. Yep, just like that. And then you can start your figure eight. You don't have to go around again. You can just start your figure eight from there. Yep. Yep, you're doing it. I'm trying. Yep. There you go. Excellent. Nope, you don't need another. Yep, you're good. That's the hardest part of the whole damn thing. I'll help squirt some soap for you.
Thank you.
Deep breath. I always take a deep breath after that because
Yeah.
that got your adrenaline going, right?
So I would give him
And both testicles are there and they look great. I usually
Yeah.
try to do a quick, check of that. There's some soap. Good. Good job. But you see how you can use that pastern to help you secure, to help you don't have to use as much arm strength when you're using when you're pulling down as when you're pulling
Yeah.
up.
I think
Those muscles are stronger than your muscles to pull up with.
I was just worried about like rope burn or something. I don't know.
Nah.
No? Okay.
Nah. I just want to make sure that's good and secure. Yeah, I think it is. Yeah, no, I think it's okay. Because as long as you got that nice and tight, it shouldn't be able to go anywhere from there. Did you take another deep breath while you're doing that? Serious? I'm really serious about that. Because it helps. It just slows you down. So secure it down into the scrotum instead of up into his flank.
Okay.
Yeah, that's the difference.
Yeah.
He can't go anywhere once he's in that, but there's a lot of room for him to move around when you push it up into his flank.
Yeah. Okay.
And do you want to do the median raphe?
Yeah.
Okay, so put 5 in that cord. Okay. And take 5 for that median raphe. And I do. So lift it up like how you're gonna.
Okay.
Yeah, and then go right along here. Yep. And then go all the way to your hub. Now, and then inject as you pull out. Pull out. Inject as you pull out. Use the whole 5.
Can I go this
Yeah,
way?
and redirect a little bit. You bet. Great. Okay. I'll take it. You're welcome. Yep. Good job.
Okay.
Excellent.
So I kind of, you're in a really good position. I'm always ready to grab this before it goes up.
And you do 5 here again, or you want me to?
Yeah, it's up to you.
Okay.
Yeah, sure, if you want. Or, you've already got 5, maybe put 2 or 3 more there, then save 3 for the median raphe a little bit more. Then come from the other, yeah, there you go. Yep. Right. And most of the nerves are going to come in centrally here with the vessel that comes right in the center of that thing, so there you go. Yeah, because some people, when they're doing if you're going to close everything, they'll occlude that vessel too. Thank you. I got soap. Yep, you got to do your final prep. So that's got soap in it. Yeah, there you go. Deep breaths, deep breaths. Beautiful. Here comes the sun. Hair secure. You happy with your sunglasses on? Which is fine if you feel good about it. I think it's plenty bright on the prescription anyway. Yeah.
You kind of want those, huh?
Yeah.
Other side. Yeah.
Good. Super. We got stuff in a bucket or everything's here?
Everything's right there.
Okay. You'll fix it with the other one. Yeah. And we'll go over the aftercare with you when we're done with his surgery.
Do you want anything specific done with the testicles? I don't know what to do.
Some people like us to throw them out in front. They say that makes the horse run faster. They say if we throw them out behind, it makes them smarter. You want them fast or smart? I guess I don't like that there's only 2 options. Excellent. Scalpel blade, please, ma'am.
Yep.
And then I'll take sterile gauze for her as well, and then open that for her doyens.
Yeah.
Doyens, please. Doyens, please. Thank you. There's your doyens. I'll be right there. You can come over here.
There's a little gray backpack, doesn't it?
So we only got 1 doyen, it looks like.
Okay.
Yep.
We're sharing. We have to share. So stretch that up tight. You're gonna put it a little, yeah. So I'd come across just right
there?
up, yeah. Lovely. Yep. Squish that good. Perfect.
What's the first thing we're doing if he starts to
Yeah.
wiggle?
So if you want to cut back to front or front to back, I don't care.
Okay.
Just don't cut into your hand.
Okay.
Are you cutting?
So I'd move your hand away. Yeah, there you go.
And say, can I please have?
And give yourself, yeah, there. So make sure your blade is through both sides of your clamp. You know, yeah, it's pretty thick right there. You're gonna find that up towards that it's thicker than it is towards the back. Yeah. And then see if you can drive that across. And if you have to do it, drive down one side and then drive down the other, I don't care.
Okay.
You know, like if you find that a little easier for you,
Yeah.
what's the difference?
He's a really good guy.
Because he's so thick, right?
It's pretty thick.
And he's got a lot of sub-Q fat.
Probably felt that a little.
1 breath. Not bad. And we blocked his skin, and it maybe made that a little easier, huh?
Yeah.
That made my life easier.
Yeah, that's what we were talking about. There you go. Now, right through that, just in one. Yeah, just there you go. Yeah. And again, it's easier to cut if it's stretched.
Yeah.
Super. I'm going to take those off.
Kind of his rhythm that he's been in,
And then, yep. Excellent. We're not going to need those, so I don't want to get everything dirty with them.
Yes.
And I'll take one of those. Thank you. So with that nice and taut, nope.
Okay.
Yeah. So see how you're scratching the tunic there a little
Yeah.
bit, which is great. That's fine.
Okay.
Just don't go deeper there. So
Okay.
so let me show you.
Okay.
What I do is I hold the scalpel blade and I just paint with it. So if I've got tension, see how I just touch it and that peels apart? Just touch it and you watch those just go away from us.
Yeah.
And the same here, as I just gently touch with it. We're pretty much right on tunic there.
Yeah.
Let's come over here a little bit so it just
Caudal
goes away from that caudal edge.
my anesthesia records.
Good. Okay, so I'd say that's about as much as I want to do because I'm
Yeah.
scratching the tunic. And then, yeah, see how easy that pops right out of there? I'm going to give you a piece of gauze in a second. I want this for the second one. So open that pack and just let me set it in there. I'll take this.
Yeah.
And I'm just going to set this in here.
Perfect.
I'm going to give you a piece of gauze, make your life easier.
Thank you.
And so so then take this circumferentially around here and use it as a tool to do your stripping. So not too much tension on this arm, but push strongly and squeeze tightly. See how easy that makes your strip? Beautiful. Big, long stroke with the push.
Got really like
Excellent. Excellent.
The strip, the clamp.
Fantastic. You're about 90% done with your strip already then. And now start getting rid of some of those pieces of giant pieces of cremaster.
Yeah.
Yep, exactly. And what I like to do with that is I'll make a window,
Okay.
push proximally, grab hold with my gauze, and rip it out towards me.
Okay.
So,
So one motion.
yeah. But it doesn't have to be one motion, but it's, here, hang on. Yeah, so take a finger,
Okay.
go proximal, hang on with your gauze, and rip.
Okay.
Because the gauze makes it easier for you to rip it, because it gives you better grip. And if it's too much muscle to, yeah, perfect. You know, and you'll kind of see like how big a piece of muscle you want to have to rip
Yeah.
is up to you. If it's a little guy and you can do it all in one, fine. But like you're gonna do it in like 4 pieces, so what?
Yeah.
Yeah. No, I don't think you need to do that anymore.
Okay.
But you just want to continue to get rid of the rest of that.
Okay.
Yeah. See? Yeah. Yep. There you go. Now grab.
But you can
Yeah. So use your gauze instead of twisting it around your finger like that. I think you'll find that it's easier. See the
Yeah.
difference?
So much easier.
Beautiful. Yep. Use your
Yeah.
gauze. It's okay.
It felt small enough to.
Yeah,
my
it did.
finger, yeah.
It did. And then now wrap your gauze once
Okay.
and do one more push down that thing, and it should be pretty much nice and clean and stretched beautifully. Good. Feel good about that?
Yeah.
And then I like to check and see how I've still caught some of my,
On the-
yeah, this lateral, see this
aspect?
fascia right here that's still attached? Stick your finger in where I'm making that tight. See where I've got my finger?
Yeah.
You do that and then rip that fascia off. Yeah, get rid of the rest of that fascia. I like my cord to be free floating before I start to twist.
Yeah.
It is. It stays weird.
Yeah, now see the difference?
Yeah.
Yeah, now you got a pretty nice free floating cord. Good. And then you either want to twist that one and get rid of him so he's not in your way,
Yeah.
and then we'll do the other. You can throw that down. The gauze you can toss. I'm gonna hand you the Equi twister. I got one in my hand still.
Okay, perfect.
So, yep, feed it through, drop it down. You're good. Yep.
Does that feel good at this angle?
Yeah, I think that looks beautiful. So a little, yep, and you can just stay with that tension. You're gonna feel that first break. When you feel that first break, make sure you don't lose your tension.
Okay.
Just like that, it's gonna break really beautifully. Yep, just like that. Let it fall off.
Okay.
Okay. And I'm gonna get you your scalpel blade to do the other one. I'm gonna take this and trade you. There you go. I'll be right back.
Thank you.
Yeah, so I would just leave this in a bucket so I can toss that.
Yeah.
You know, and just use less mess on.
We're doing it differently.
Yeah, it doesn't matter. Either way, whatever you're happy with. Beautifully. So just paint with that.
Yeah.
Yep, just
I
so
see the-
yeah, see, and then you start to see the tunic. So you know you really see how that stretch allows it to just peel away from your blade.
Yeah.
Beautiful.
Oh,
Yeah, careful. So
far.
so use the flat of your blade, not the tip.
Okay.
Yeah, and just paint. Yep, good. How you feel about that?
I feel pretty good about it.
I do too. I think you could do, maybe just a little more
okay,
right
I
through
see
here.
it.
Just gentle, really gentle. Nope,
Oh, getting into
that's
it.
okay. Yeah, because that's still fascia. But I think it's thin enough to not futz with it, or you're going to end up through your tunic. I think that's beautiful. I'm going to trade you that for that. Open that up so you have it to go around with. Beautiful.
Done with that?
Yeah, I'm probably done with that.
Okay, good, good.
And then Amanda's getting the drugs that we're going to
Yep.
put in.
And don't futz with that. You don't need to. It's going to come with you. Yeah, see?
Okay, so still a little tense.
Yeah.
A little tense, but nothing's changed.
Yeah, just like that. Yep. Gentle here, strong there.
Okay.
Yep.
So we're halfway
Excellent.
through the ouchiness.
Excellent.
So I'm pretty.
Nice.
Yeah, I'm happy.
So I'm just going to so see where this big chunk of fascia
Yeah.
is still here? So I'd make my window in it
And then go down.
and then
Dorsal.
push it dorsally. Yep. Grab with your gauze because it'll give you strength. And there you go. Nice. And I might, if I have something, I'm going to trim this with because this is going to
This is
hang.
hang.
Yep.
Okay.
So you work on that cream ester. I'm going to find something to do that with. Whoa, moving.
You good?
I'm good.
Okay. What do you need?
You guys, I don't think we need a ton because we're going to twist pretty soon. We're almost done stimulating him, but
A little violence.
yeah, beautiful. And I'm going to work on this just because of that. Well, I think we're okay. Yeah, so just jam your finger through that thing. And what I find is if I go up and down with my finger,
Yeah.
it breaks that fascia apart.
This way. The gauze.
Or,
there.
yeah, if it's being too tight, yeah, see, yep, there you go. So take that piece instead. Beautiful. Now soften a little bit so the muscle relaxes,
Okay.
and then you'll find where you want to get in between it. See how that worked?
Yeah.
'Cause with the muscle, you don't want the tension until you can find where it is.
Yeah.
And just break that piece off of there, however which way you can.
It's tough.
Yeah, it is being a little tough, huh? fine. I happen to have this here. I'll
Thank
help
you.
you out.
This one's pretty tough on this side.
There you go. Good. So now take your gauze around in a circle and do like 1 or 2 more strips, and don't go that low. Start up a little higher above that chunk of muscle.
Higher here.
See, start above that piece that you already. Yeah, leave that attached and ignore it because it's going to come out with him anyway.
Okay.
See the difference?
Yeah.
Instead of having to fight with that piece that still wants to fight with you.
Mm-hmm.
Beautiful, beautiful, good,
Okay.
good, nice, just like that. And now we can kind of check our cord, make sure it doesn't look like anything's still hanging on there.
It's pretty freed up.
I think.
Just this portion here. Yeah.
Yeah, let's get rid of that. Oop,
Oh,
now we're
open
open,
it.
but it's okay. So we're gonna just leave it.
Okay.
We're gonna be fine.
So Brandon, you got
So now toss
Here,
your
cut this free.
yeah,
Okay.
toss your gauze, and we're just gonna check this for big vessels.
I don't see any good big
And
vessels.
so you can nip a little, and then push. So use the back, yeah, just like that, and then push instead of cut. Yeah, push. It'll bleed less. We're gonna do that one more time. Squeeze a little. Yeah, there you go.
Nice.
Beautiful. Excellent. And that's just while we got those scissors in our hand.
Okay.
Let's just do this one too. Drop the nut. Just drop it. Yep. Beautiful. And maybe that tag too. Just because you sure got a lot.
Yeah.
Excellent. Yeah, that you'll be happier later that you did
Yeah.
that. Okay, so set those on your tray and pick up your Equitwister. Your angle's going to be pretty
a little bit this way.
Yeah, and because you're open, so just realize that you're not going to have that first tunic break because it's already done that. Okay. So and you're not, because you're open, no more tension than that, but
Okay.
just consistently that, but no less either.
Okay.
You're good. We're twisting the second. Feel that first little bit of rupture,
10 more seconds.
and you're doing beautifully consistent tension. Don't let it fool you into releasing tension. Yeah, just like that. You go a little faster now, a little faster, and then you can go fast. Beautiful.
Nice job.
Okay, and we are happy. We can check one more time to see if there's anything else we want to get out of there, but otherwise, I think we are done.
I'm happy with that.
Me too. Good job. Okay.
I'm gonna get some blood.
Um,
Put some slide on him.
if you want, but if we've got it, if not, whatever.
What do you need to do?
Oh, if we wanted to put a little swat around him to keep the flies away, but yeah, go ahead and grab it. We'll do that.
No.
No, it's the woman.
Over there.
I'm not, she'll come back. Yeah, we'll make sure we got that. Okay.
Seeds going in.
Great.
That's the first time I've seen him do like that
With that instrument, yeah, it's a really nice. I find that to be a really nice instrument.
A lot of people just use that masculator and then.
Yeah. Which, and there's pros and cons to both. Here, I got a clean glove here.
Oh, that was not clean. That was dirty.
Well, it was cleaner than.
I had a clean glove.
Oh well.
Fight him 3 times. Like he'll wiggle, fight him back, he'll wiggle, fight 3 times. I will do it as many times as he lets me. Usually it is around that number. But I sit here both and put this up, cradle his nose as much as I can, whatever's most ergonomic.
That's why you use the pink swat instead of the clear
And if he's, like,
or the
fighting,
white.
fighting,
The pink swat, and then it mixes the blood in nicely.
Oh, there you go.
Good.
All right, I'm gonna start letting down.
Yeah. Hang on. Let me get my face out of here. Okay. Go. Good job.
Thanks, Doug.
You are welcome. So yeah, like, and again, yeah, okay, so we were a little aggressive with our blade, so we got an open tunic, no big deal. We just need to know we can't pull on that open tunic too hard. Beautiful. I'm gonna get my face out of his foot. Yes, sir.
When she was twisting that thing in there, does that inside
What that-
it just rips out the
So what that does is it takes those blood vessels that are inside that spermatic cord and twists them up till they rupture. And so they're twisted so tight that they don't bleed.
Oh, really?
Yeah.
See, a lot of them I seen. There was an outfit that did some in the Hopi land, like you guys in non-profit deal. And that horse came to, and that sucker just jumped up and
it started really bleeding. So in terms of that, there is always a risk of that happening if they don't have if their inguinal ring, which is the structure that holds, that separates the body wall from the scrotum, if that inguinal ring is open and not closed and not small, then that's always a risk with castrations. And
this one doesn't do that?
Hopefully no. Well, and that's not really dependent on your method of castration. That's really more how that horse is built and whether he's got a higher risk for an inguinal hernia, because that's exactly what that is an inguinal hernia. But now that there's no skin or any scrotum left, that intestines can come outside the body.
Yeah, but the horse was just kind of like, when he came to, he just kind of
fighting a lot.
Jumped up right away.
Yeah.
So they put it back down and they had it on her back, and by that time the guts got dirty and everything. They tried to push it back, gauze it and everything.
Yeah.
And when he came to, he jumped up again, and
it's a nightmare.
Stitching nothing.
Yeah, that is a risk of castration, and no matter what your procedure is, you can't eliminate the risk of that happening. We could put suture in every horse's inguinal ring to try to keep that from happening, but then those horses would have a much higher risk of infection from putting that suture in. Oh shit.
Get on in. Get on there.
Yeah, that's right. He's gonna get up.
Good job, little guy.
Taylor rolled pretty good.
Yeah, it was a little quick, huh?
He says they're done. So yeah, you're right. Sometimes they don't fight you, and so that's where that preparedness at any moment, test your knees and test your quads, comes in.
He's older than 5.
Yeah. That's what I was
Don't you think?
thinking.
When we did it,
What do you think?
It said 4. You think he'd...
His owner said 4.
Yeah. No, I don't buy that.
I think he's a little older.
Yeah.
I think he's even like coming 6 probably by my thoughts.
Yeah, I agree.
Maybe even 7, huh?
6, almost 7.
Because especially with that little notch on his incisor. Everything went beautifully. The surgery went really well. The student did a great job. We were working a little bit on technique with that, changing up a little to do a little more sharp dissection down to the tunic, because he's a little bit more mature than some of the other horses that we've been doing. He has a fair amount of scrotal fat, and his scrotal fascia was pretty tough. So to have to just fight our way through all that, we might as well use our tools at hand, and we have a scalpel blade open that we use to do our skin incision anyway. So we might as well utilize that to not have to fight so much with the fascia, and make our job a little faster and a little easier. And she did a really great job with it. You are welcome.
Okay. So you can't say that you got 12, 13, 14, 15 milliliters of ketamine from one bottle. Do you know what your other bottle number was?
I didn't write those down, but I think it would be 86. It was Dr.
Is this your
Allison.
tray?